begin with this week's news about vaccines. We'll get to some of the specific things that Genentech is doing in a minute, but I think it would be useful for our viewers if you, as a leader in this industry, could help us decode the announcements from Pfizer about this phase 3 trials of its COVID-19 vaccine. And we're expecting in the next day or two an announcement from Moderna, a U.S. company that's got a similar vaccine with a similar structure. Tell us in terms of both safety and efficacy, what you make of the claims that have been made for the Pfizer vaccine and endorsed by none other than Dr. Anthony Fauci, not a man given to hyperbole. Tell us what your view is.
Well, it's tremendously exciting news. I think this is something that the whole world has been eagerly awaiting. So it is tremendously exciting, and the results look really very, very good. So it's absolutely wonderful news. There's still a lot to come. There's a lot more we need to know. I think it is important for people to realize that we need multiple different vaccines from multiple different companies, and then mobilize those globally to really address this pandemic. And I would say the other point, and Genentech is a company focused on therapeutics. As you mentioned, part of the Roche group, and the Roche group is also focused on diagnostics. So we're therapeutics and diagnostic focused. It's actually going to take therapeutics, diagnostics, and vaccines for us really to address this pandemic. I think that's important for us to realize, together with all the public health interventions that by now we should really understand and be utilizing to be able to prevent the spread of this pandemic. So it's really going to take these 4 interventions for the world to get ahead of COVID-19.
Let's look, Alexander, at the specific aspects of dealing with COVID-19 that your company and its parent have focused on, starting with therapeutic treatments. Genentech this year has had, as I understand it, a partnership with a company called Regeneron to produce a kind of antibody cocktail like that was given to President Trump. I may be misstating the science here, correct me if I am, but I'd be very curious to hear about how you think that research is going, what the Regeneron can do as a therapy for people who've gotten COVID-19 or are showing symptoms, and where the research is going.
Yes, David. I mean, we have 10 drugs in all stages of research and development that we're developing for COVID-19, and a couple of those are part of partnerships, and one of them, as you rightly say, is with Regeneron. This is for a monoclonal antibody cocktail. And we basically, we're the largest biologics manufacturer in the world, Genentech. The largest manufacturing site for biologics in the world is part of our manufacturing network here in California. And we realized that apart from research and development, that we could play a very significant role in manufacturing. And monoclonal antibodies, one of the biggest challenges is producing enough of the drug to make a difference for this disease. It requires very high dosages. There are still studies determining exactly what the dosage is, but it looks like it's going to be large dosages required, therefore large amounts of manufacturing capacity required. So we actually were approached, and we had discussions with numerous different manufacturers for therapeutics and vaccines, and we really thought deeply about where we could deploy our manufacturing capacity and our capability to have the largest impact. And we actually identified the Regeneron monoclonal antibody in our minds was highly promising, both in terms of the role it could play in the treatment of severe COVID-19 pneumonia, and also where the significance of the role that we could play and how we could really significantly impact positively their success in producing and distributing the drug. So again, this is a monoclonal antibody. There's still studies ongoing to figure out where the best point in the disease course it is to deploy this drug. This alone is not going to be the whole answer. We're going to need multiple different therapeutics. And in fact, one of our other partnerships we just recently announced is with another company called Atea for the development of their research, development, manufacturing, and distribution of a molecule that they discovered called AT527. And that is a small molecule therapeutic against COVID-19 with the promise really of potentially being able to intervene when patients first develop symptoms outside a hospital setting. So again, we need therapeutics that intervene in all different stages with the very different clinical manifestations that this disease has.
And tell our viewers, Alexander, who I'm sure are feeling the anxiety the whole world is as we look at this winter spike of coronavirus infections, what we can expect over the course of the next several months in terms of therapeutics. The Regeneron monoclonal antibody cocktail that was given to President Trump, as I understand it, is still in the early experimental phase. What's going to be available to people over the next 3 or 4 months if they get sick that's going to help them get better?
Well, there are already therapeutics that have received emergency use authorization. So, of course, there's remdesivir. That's from the company Gilead, also a California-based biotech company, and we're also partnering with them on one of our molecules in combination with remdesivir. So that is already available and now approved by the FDA. Lilly just recently received emergency use authorization for their monoclonal antibody. And Regeneron and ourselves are in discussions with the FDA over emergency use authorization for the monoclonal antibody cocktail that you just mentioned. And I expect that, should those discussions be positive, those therapeutics could be a very significant part of intervening and managing the disease. In the meantime, as you also mentioned, we'll see the Pfizer vaccine, and then we're eagerly awaiting the data and then hopefully the approvals of various other vaccine technologies. And then there's just an enormous number of other therapeutics that are in various stages of being studied for treatment at various stages of the disease. And the oral, I think, is going to be a very important potential advance. That is further out. So nearer term, it will be monoclonal antibodies, drugs that address the inflammatory stage of the disease, and also remdesivir.
And Alexander, there's one anti-arthritis drug that you have produced under the name Acterma, if I have that right. Its formal name is tocilizumab, which has had it's seen positive results in treating patients, although the studies on that are mixed. Is that something that you're hopeful for?
Well, David, the drug is Actemra, and you did a wonderful job pronouncing the generic name tocilizumab. And yes, we've been studying this right from the very early days of the pandemic. We first heard anecdotal reports from China and Italy from clinicians who are using it to address the cytokine release syndrome stage of the disease. This is in the patients in the latter part of the disease where they get a significant immune response triggered by the virus, and you have to damp down the immune response. That's the hypothesis, and we very quickly developed phase 3 studies It's really important. I think that's one of the learnings that I think that we have as a society around COVID, is that nothing replaces robust, well-controlled clinical studies to really answer the question of the clinical utility of interventions. And so it was really important that we had those phase 3 studies, and a number of them have now read out, and we've discussed those results with the FDA. The results are mixed. There's some positive endpoints and findings, and some negative findings. And so we continue those discussions with the FDA, and specifically, we're waiting for another phase 3 study, which is looking at the combination of Actemra with remdesivir. This is the REMDACTA study, and that will be an important to see if there's an additive or synergistic effect between the two medications in, again, treating patients in the more severe stage of the disease. And we should get those results in the first part of next year. And so that will be very important to see those findings, and then we'll of course discuss them with the FDA and about and determine, what role, if any, does this drug have in the treatment of COVID.
There's one more therapy I want to ask you to comment on for our viewers, and that's the nasal spray that it's said could be sprayed in your nostrils and have the effect of killing the virus right at that point where you may be acquiring it. Do you think that's a promising approach?
David, I don't know enough about that, but I would say that as I just mentioned, it is just so important that we really rely on well-controlled clinical studies. There is obviously so much pain, suffering, and in many cases false hope provided as people grasp for potential solutions. And it's very nice to think that something quite simple but could be quite effective. But this is a really difficult disease. We're still learning so much about it, and so I would really encourage people to really rely on the evidence and to be patient whilst we really understand what works and what doesn't. We've learned so much, and we still have a lot to learn.
And one more question about therapies before we turn to diagnostics. As we look at the statistics, we see these stunning rates of infection, now well above 140,000 new cases a day. But thank goodness the death rates are very substantially lower. They're on the order of 1,400 a day, or something like 1%, a little over 1%. What should we draw from that? We remember in the early days of this pandemic, death rates as high as 5%. Are we seeing the product of knowledge among doctors, among your pharmaceutical industry about how to take better care of people that are leading to significantly lower death rates?
Well, David, it's a very interesting and important question, and the answer is we don't know definitively. But I think what you said, which is we're learning and we're treating these patients more effectively, we definitely have better interventions, it would make sense that that's part of the reason. Another reason, though, is the population that's getting the disease at this stage is a younger population, a younger, fitter population that generally has a better prognosis when infected. So there are a whole number of different factors, but I can definitively say that we are certainly learning a lot about how best to treat this disease, and healthcare professionals do have more tools than they did in the earliest phase of this disease.
So now let's talk about diagnostics that will tell people whether they have COVID-19, whether they don't have it, often just as important, and whether you see new technologies moving fast enough that someday soon we'll be able to get much quicker on-scene on-site results. I was listening last night to Dr. Francis Collins, the head of the National Institutes of Health, who was talking about his dream of just a routine morning check to see before you go to work whether you have the virus, like brushing your teeth. You'll have something you can just, swab your nose with or in some way measure and get a result that quickly. And then you'll know today it's safe for me to go to work. Today I need to stay home. Do you see something like that coming in the near term? And I mean by sometime, let's say, in the middle of next year.
I think, as I mentioned before, I think it's going to be a combination of testing, therapeutics, and vaccinations that's going to really allow us to get ahead of this disease and return life to normalcy, which is something we all are just really striving for and yearning for. And I think that testing technologies are at a really exciting stage right now. Absolutely, what we need are tests which are really widely available at the point of care or self-administered that give results very, very quickly. The disease, we know that the issue, a large part of the issue is asymptomatic spreaders. And so with proactive, regular, rapid testing, we can identify those people and we can prevent the spread of the disease. So I do think that technology is moving very quickly. Our parent company, the Roche Group, has Roche Diagnostics. We actually have 5 different COVID-19 tests. As of October, we've delivered more than 30 million of them. The initial tests were laboratory-based, highly accurate PCR tests. The latest developments that we're working on are more rapid tests at the point of care, easier to administer, eventually, hopefully self-administered, and easy to administer and producing those rapid results. And I do think that's going to be an enormously important stage of getting ahead of this disease.
And I'd ask you what advice you'd give on this question of testing and related issues of travel and social contact to our many thousands of viewers who are trying to make plans for Thanksgiving and wondering, should I go see my relatives this year? Should I get tested beforehand? Should I get tested after I arrived? I don't want to ask you to be a public health advisor, but you know a lot about testing and what's available. What would be some basic advice you'd give to your family, say, based on what you know?
Well, I think every family is having that discussion. If they're not, they should be having that discussion and thinking really carefully. And I am not a public health official, and of course we should all be listening to them, but then having those discussions. There's tremendous excitement about the vaccine developments. There are excitement about the therapeutics. We can't get ahead of ourselves right now. That's what I would say. That's this discussion that I'm having with my own family, with 2 daughters in college who potentially are coming home, with the usual group that we have Thanksgiving that have elderly family members. We're not going to have a normal Thanksgiving this year. And that's just the reality of where we are with this disease at this stage.
I want to ask you about one of the most painful issues associated with the COVID-19 pandemic, and that's the unequal impact it's had on communities of color, among poor socioeconomic groups. And it's a deeply disturbing aspect of this pandemic. I know that your company is trying hard to think about ways to lessen this differential, this especially harsh impact. Talk a little bit about this problem and how you at Genentech are thinking about how to respond to it.
I think this is one of the tragedies of the pandemic. It's really brought into sharp focus the issue of health inequity and the issues in our healthcare system. We obviously have a virus which is disproportionately impacting minority populations, but underlying that are structural and other issues in our healthcare system. This has been overall an area we've been focused on as a company in the other disease areas that we are in, like neuroscience and cancer. But we saw very early on that this was an issue in COVID. We saw the worst health outcomes in minority populations. And then we also saw that there were access issues in those populations for the initial therapeutics and studies. And so again, studies that are representative of the populations in the US is already an issue. And then we saw in COVID that this was potentially going to be even worse in a disease where we knew those underrepresented populations were going to have worse health outcomes. So we mobilized immediately on this topic. And actually we set up a specific phase 3 of one of our most advanced therapeutics in development for COVID, specifically to recruit underrepresented populations. And we did this in the midst of the pandemic, and we successfully enrolled that study. It was actually the fastest enrolling study in the history of our company. And we managed to recruit 85% of the study population were underrepresented populations. So largely Hispanic, Latinx, African American, and actually also Native American. Perhaps most interesting for your listeners, the largest recruiting site of the entire study was in New Mexico on the edge of the Navajo Nation. So this is a challenging situation. This exposes problems with our system. But what I'm really inspired by is that we've been in the middle of this. We've been able to work with HCPs, with healthcare providers, and with the community to mobilize a study and do it really well and produce a result. And I think these learnings are going to carry on post the pandemic. That's my expectation. Certainly we will carry those learnings forward. And I hope that research and development of drugs will be a lot more equal and equitable going forward.
And what do you say, Alexander? What have you learned to say to people from minority groups or just folks who lack trust in the medical establishment, who are suspicious of vaccines, who feel that they're being experimented upon, that there is a deep mistrust out there, some extraordinary numbers suggesting 50% of the people won't want to take a vaccine when it becomes available. How do you build trust, or I'll say rebuild trust, in science and therapies that can be helpful among people who have this deep suspicion?
Well, David, I think you're really getting to a very fundamental question. I think trust is what we need to really build. And part of that is by working together at the very, very outset of research and development. We have to include them in the research phase. We have to include them in the design of our studies. And then we have to go out and work in partnership with lots of stakeholders to really engage with these communities. There is distrust, and it's going to take time to overcome that distrust of the healthcare system. There is a distrust of the healthcare system, and it is an issue. So I did in earlier in our talk, we talked about partnerships between companies. I've hinted at the really important topic of partnerships between companies and the government. I mean, the FDA has been a tremendous partner, and as has BARDA, which is a very important part of mobilizing research and development in the United States. But we also need to partner at the local community level to be able to address these more fundamental challenges. So when we look at the discrepancies in terms of utilization, whether it's of vaccines or therapeutics, we really need to get to the root cause of it. Sometimes we think it's only about affordability, and affordability is part of it, Part of it is distribution, but part of it, and a large part of it, is trust. And as you talk about, whether it's therapeutics, whether it's vaccinations, or whether it's diagnostics, all of those require trust amongst the community to fully embrace them in the fight against COVID-19.
Last night, in conversation with Dr. Francis Collins, the head of the NIH, I heard Dr. Luciana Borio, a prominent infectious disease specialist, who's a member of President-elect Biden's coronavirus task force, speak. You can watch this on YouTube. The Washington National Cathedral sponsored the discussion. But Dr. Borio was fascinating in talking about the ways in which the president-elect's group is beginning to think about how to deal with this deepening crisis of the pandemic this winter. And I want to ask you, perhaps as a closing question, what thoughts you have as the CEO of a key company in our biotech pharmaceutical space that might be useful for the Biden task force and for everybody who's thinking about how we do this better. What should be on the do's and don'ts list as we have a new administration preparing to think about what to do?
I think we've had a good partnership with the current coronavirus task force, and again, partnership is really critical. So I would really encourage them, and I expect this would be the case, to really embrace partnership, encourage partnerships between companies. As I mentioned, we believe, and that's been a very big part of our focus, has been partnership between companies, but also partnerships between the private and the public sector. So lean in with us. And also think about the full continuum of all the different interventions. Again, diagnostics, therapeutics, vaccinations, and other public health interventions, and make sure we're moving together on advancing the movement on all those different fronts. So I think probably partnership would be my key message. We are fully mobilized as a company in all aspects of COVID, and we're fully committed to making a significant difference against that disease. But we know we can't do it alone. We need partnership. So that would be the key message that I would deliver them.
And in the half a minute we have left, just briefly want to ask you, it sounds like your industry may have changed in some permanent way in its dealings with each other, its dealings with the government. Is that the feeling you have as you look at Genentech and other companies?
I absolutely do, David. I think this has been, whilst this has been enormously challenging for the whole world, there are some positives that are going to come out of this. When we work together towards a common goal, we have unlikely partnerships. We have partnerships with government, and we're working in ways that we've never worked before and at speeds we've never worked before. And we're addressing issues like health inequity with a seriousness of intent and a sense of urgency that I've never seen before. So I think that things will not be the same after the pandemic. What we're trying to do and how we're trying to do it, and I believe also our success will be increased as a result of the learnings and the changes that we've had to adopt as a result of fighting this pandemic together.
Well, I want to thank Alexander Hardy, the CEO of Genentech. It's so useful, I think, for our viewers as we head into this difficult winter to hear from the people who know the most about these new therapies, new drugs, and just walk us through what we can expect. So we thank Alexander. Next up on Washington Post Live on Monday, my colleague Jonathan Capehart will interview Congresswoman Ilhan Omar. On Tuesday, we'll have a Chasing Cancer special, and Harley Finkelstein, president of the commerce company Shopify. Until then, have a good weekend. We look forward to seeing you next week at Washington Post Live.